everybody. I'm glad you could join us. Tonight, we have a special guest, Dr. Richard Bartlett, and I think you're going to really enjoy this one as we talk about various PBM applications and his new entrance into the field of PBM and what it can do. So, with that being said, just go through and tell everybody about if you've joined us for the first time tonight. We have a giveaway of a Palm Ultimate. We do that once a month, and that the Palm Ultimate is a $1,400 device, and it has the two wavelengths, the bright red, and you can see it going right through my hand here, and then we have the near infrared wavelength, which you can't see very much, just some purplish dots there, but it's actually going much, much further. Much more is coming through my hand with this wavelength, even though you can't see it. So one of these Palm Ultimates will be drawn at the end of the month, and we give that away so every time you've watched us, so if you watch us 4 times in the course of a month, you get 4 ballots put in, and that will then we do a randomized draw, and we'll see if you are the winner. So we also hope tonight that we can have Kylie with us talking about her daughter and how her daughter had a lot of seizures. We're talking 10 to 15 seizures a day. And these seizures, she's 7 years old, and they started already at 3 years old. And with the helmet, it was loaned to the mother, and the helmet was used, and her daughter was able to be to drop those seizures from 10 to 15 seizures a day to down to less than 1 seizure a day. And now it's even to the point of every number of days, 4 or 5 days before there's a seizure. So we have we're trying to work something through with some technology here. So, we will be having Dr. Bartlett on in just a bit, but we're going to just start off with a video very shortly. But I just want to show you the helmet we were talking about. This is our SunPowerLED helmet. This is the regular helmet. And so a person would just use this helmet on their head like this, and they use the red light treatment, and they do like a minute of that and 3 minutes of the near infrared. And with Kylie's daughter, she used this light for 30 seconds of the 1 minute, 30 seconds of the red and 1 minute of the near infrared. And that's what ended up giving her the success that she did, where she was down to 1 seizure a day from then on. So that was our helmet. And this is our mini canopy. This is like a foot square. So it treats a large area of the body. And it's equivalent to 15 of the Palm lights over the whole area. So about 15 times the area, 12 times the power of one of these little guys. So it treats a very large area of the body. So we have these, the helmet and the mini canopy as well. We have I mentioned about the Ultimate earlier, and then we have the Super Palm, which is the one that we have that we'll be talking, Dr. Bartlett has been using, is the one that has the 660 nanometer wavelength, same power on the red, but it's the near infrared that we have here, which is 1050 nanometer, and it's actually, you can start seeing a little bit of the purplish dots, but it's pretty much invisible. Well, to my eyes, it's totally invisible. But if we take an Android phone and we put it in front of it, then you can see the purplish dots there. We ended up putting a little red indicator on the side here because people in the beginning, when I first built this device, they said it's not working. And it's just because they couldn't see the near infrared at 1050. Your eyes just can't perceive it. So with that all being said, that's our different products that we have. And now what we're going to do is go to a short video, and then we will start our conversation, and hopefully our audio will be working with Dr. Bartlett. So here we go.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
tPBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's a sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have 2 different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm Series, can help you, please reach out to us and we'll get back to you as soon as we can.
All right there. So now we get to invite our special guest, and we'll hope for the best with the audio, Dr. Richard Bartlett. He's from Midland, Texas, and let's hear you say something.
God is good.
I love
it.
I thought we might have to bring the mute back to speak, but we were having for the folks that don't know out there, sometimes challenges can happen big time when you're talking technology. No matter what we tried, we couldn't get the audio working, but thank you, Lord, that we got some audio working tonight now. So anyways, great to meet you. So maybe you could tell the audience a little bit about your background. I'd love to hear it.
So I've been practicing in Texas, and I'm an MD that has been an ER doctor and family medicine doctor for 34 years now, and I was appointed by Governor Rick Perry to a new task force called the Health Disparities Task Force to try to give advice every quarter to the governor on how to make access to quality health care present for every Texan. And that was it was actually a 2-year appointment. After 2 years, Governor Perry asked me, would you stay another year? And I did. And then after that, every year after year, he kept asking. So I was there for a total of 7 years. At the end of 7 years, we accomplished a lot. And so he gave me I was surprised that the Secretary of Health and Human Services gave me the Meritorious Service Award because we had accomplished a lot. Fast forward to COVID, I am working as an emergency room doctor in March of 2020. Remember, all doctors and all Americans were told there's nothing you can do. Right. Just stand down, wait for us to make a vaccine. And if people get real sick, we'll put them on a ventilator. There's nothing you can do. And that didn't set well with me as an ER doctor. I was praying in between patients in March of 2020 on a 48-hour shift in the ER, laid down in the call room during a cat nap. An answer to prayer came to me while I was asleep. It's been used around the world and saved millions of lives. Senator Rand Paul has talked about that with Glenn Beck. Glenn Beck told everyone on his show that I had treated him, and Rand Paul has been using my strategy of an inhaled steroid and aspirin and a right antibiotic to save lives as a doctor himself. The two cities that I work in, Midland and Odessa, Texas, both of the city councils did proclamations of Dr. Richard Bartlett Day after the fact. And so Oxford University proved I was right in the STOIC trial and the Principal trial and the Together trial. Oxford's the oldest university in the English-speaking world since 1096, with 72 Nobel Prize laureates, and Oxford proved me right. So God is good. And I met you at the Autism Health Summit in San Diego, and wow. You have invented an amazing product. I bought one of your devices and was using it in my office. I had a lady who had a heat stroke 12 years ago. And after that heat stroke, something changed where she was having migraines that would last for 2 to 3 weeks at a time. And they're very debilitating. And She had another migraine, called me, and I said, come on in. And so we used the the Super Palm 1050, and almost immediately her nausea was gone. And then she said the flashing lights are gone. And then she said, the light doesn't hurt my eyes anymore. And she was pain free in 10 minutes. She could not believe it. She was speechless. She is still, that was a week ago, and the pain did not come back, and the nausea didn't come back. And so the only thing we did was the Super Palm 1050.
Sorry, that was only the one treatment?
Yes. And so we invited her to be on the radio and meet you for the first time, the inventor of this product that helped her. And so on talk radio, she got to meet the person who invented this device that gave her her life back. And we're supposed to alleviate human suffering and do no harm. And so there's something to be said for alleviate, even if someone's going to live, it's still all right to alleviate human suffering. And so, Tom, that's what your product has done. And we had another gentleman who had epidural steroid injections for back pain, had eventually a implant put in his back where you could see the little box under the skin, and he was still in constant pain for years, going to pain management doctors on narcotics, on everything that they could throw at him, and he was still in pain. He used this Super Palm 1050. It's that 1050 wavelength that's the game changer, and he was pain-free in 10 minutes. And so he said the pain came back a couple days later, but he ordered his own 1050 Super Palm so he can be in control of his health and in control of his life. And so, my mindset is, if you can buy this device and you can take control of your health, you don't need to be coming to my office and paying me to use mine. Go ahead and take control of your life.
Yeah.
And so, anyways, we have seen success story after success story, and I am thankful for that.
That is so beautiful. Yeah, during COVID, for the audience, you had treated over 1,000 patients that were difficult patients. These are not the ones that are easygoers. These are the ones that have comorbidities, right? Difficult.
Yeah, and so if people go to drrichardbartlettusa.com, they can watch all the documentaries. They can look at the studies that confirm what I presented. And actually, we published the treatment strategy. We were the first to publish a successful treatment strategy for treating COVID early disease and late disease. And that was in July of 2020. So this was suppressed and censored by YouTube, by Facebook. We saw Mark Zuckerberg admit to Congress in front of the whole world during a hearing that he had censored and suppressed critical life-saving information about COVID, and this is part of that. And so we're thankful that we're not helpless or hopeless, and there are winning strategies, and God still answers prayer, right, Tom?
He does. He does. As a matter of fact, a person that I hope we'll be able to bring on and just see if she's up, please, is the one woman with, nope, not yet. But she's trying to wrap up her workday and get on the air when she can. So hopefully she'll be able to join us around in the latter half of our program. But she had 10 to 15 seizures a day. As a matter of fact, last fall the daughter was up to 50 to 60 seizures a day. And now the daughter has been able to, after the first treatment, she was down to less than one seizure a day after the first treatment. That was 1.5 minutes of the light therapy with the helmet. So that was with this helmet. Okay, we'll bring it around here. There it is. That was 30 seconds of the bright red and 1 minute of the near infrared. And after that first treatment, she was then down to less than one seizure a day on average. And then it's just been the last now couple of weeks that she's down to even once a seizure every 4 or 5 days. So, and she's still doing it. I did suggest that about a month after she got going, we started kind of slow with low amount of light and or a short period of light treatment time, and I asked her to double it up, and they doubled it up, and it was very effective. But we've also been able to see with autism the improvements in reducing inflammation on the brain. Now, can you, to the audience here, can you explain what kinds of things have inflammation on the brain that I think you've heard me talk about what can be helped or what we've seen.
Well, I got to tell you what I've seen in my office. I've seen patients who have knee pain, back pain, different musculoskeletal pains get immediate relief. And I have seen a patient who has stage 4 colon cancer who has an ileostomy and a PEG tube and had bowel obstruction, was not able to use his feeding tube, was not able to take nutrition by mouth or by the feeding tube because of the chronic obstruction. And using this light therapy on his abdomen, his pain went away on his abdomen, and he started to be able to eat. This is on day 6 of me seeing him in my office. He is there's lots of factors, but after having constant pain, is pain-free. And so again, he's taking some nutrition by his feeding tube now and by mouth if he closes the G tube. And his ileostomy is functioning now, and he's pain-free. All of those are wins. So I'm just saying that it does decrease inflammation of various kinds of inflammation. And you're talking about the brain. The thing that I've noticed is with the migraine case, which was a tough nut to crack. That's a pretty impressive win, where the patient's eyes are bugging out and shocked, and she's thrilled. She can't explain why she's pain-free after going to ER after ER for years and seeing neurologists and other specialists, and nothing seems to break it. And this broke her headache. And so that's the neurologic situation that I've seen. And Tom, you're the inventor, you're the rocket scientist, but I can tell you as a witness what I've seen in my office with patients.
That is beautiful. Well, we, for the audience here, what we've been able to see is all kinds of things with inflammation on the brain being helped. So just to give a few, Parkinson's, we do have videos on our YouTube channel and also on our website about severe Parkinson's, 20 years of Parkinson's being able to be turned back to the point where now he couldn't read a few pages, could only read a few pages in a book and couldn't remember what it said. Now reading 400-page book and telling you what's in it. To not being able to laugh and smile, they lose their ability to control their face. And now he tells jokes and laughs and smiles. He also couldn't write, like it was just gibberish. He couldn't make out anything that he wrote. We have the evidence of that. And now you can read very clearly in the block letters that he writes out instructions to his wife how to change the battery in the scale, in the bathroom scale. And I remembered even he put CR 2030, which is that coin cell. So he even went that far to describe this letter, this short page that he wrote to his wife to change the battery. But to be able to do that and then be able to communicate once again. And with Parkinson's, they can go through where they freeze, right? They want to sit down and they get part way there and everything stops. Doesn't go up, doesn't go down, just in this, and that no longer happens. His wife was ready to take him in because she couldn't handle him anymore. There was just too much. And she says, I got my husband back. So, to be able to, strokes, I've even seen somebody with a stroke that was very, very old. Old stroke, not the person wasn't old, but the stroke was 20 years earlier and couldn't speak clearly. And in one treatment, was able to start speaking clearly again. So we've helped the eyesight of people. So I can hardly wait till you have more. You've only had the light for 3 weeks. Wait till you see some of the other things that we've been able to see. But it's beautiful when you can speed up healing tremendously. So I know we've already started to have questions pour in. So I tell you what, we are going to, because I know Kylie will be coming on, what we can do is we can start answering some of these questions or other thoughts before we get into the questions. Any other thoughts that you have about this light treatment?
Yeah, no drug interactions, no allergic reactions. This is a totally different way to handle pain and migraines. And, sometimes emergency room settings with doctors and nurses can be a little callous, and they talk about frequent flyers, use that term for people who are patients that many times are frustrated with a chronic condition and they're seeking help over and over. And some of those conditions are like migraines or chronic back pain. This is a game changer so far, in my opinion. This should be in every emergency room in the United States. If it can decrease pain without the risk of addiction or drug interactions or allergic reactions, this is a no-brainer. We do other things that are not medications to try to help people in the emergency room. This is a powerful tool, and it's really the 1050 wavelength that my experience is with. So I have to believe that that's the game changer. And so there's other near infrared devices apparently, but I don't know that any of them have 1050 wavelength. I think that's the difference.
Mm-hmm. Well, we are definitely seeing some beautiful things with the 1050. We do have the Palm Ultimate with the 810, so we are getting some results with that. But I got to agree that we've been able to see even more stuff with the 1050. So thank you for mentioning that. So we'll ask. There's probably a couple questions. Russ saying, "I appreciate all you're doing to educate about PBM." And somebody mentioned, I know we got people out there hearing this. We usually, if we have an audio problem, we get 30. So we must be coming through. Check your volume on your phone or yeah. So Susan's saying, thank you for this guest. Which of the helmet or mini canopy would be the best for someone with 2 years of
Polymyalgia rheumatica?
Oh, thank you. I'm torch. Anybody can tell I'm not a doctor. I just tortured that.
Here's what we're doing. And here's what patients are doing on their own when they buy this. They're using it when they are hurting, and when they're not hurting anymore, they stop using it. If it's their elbow that hurts, polymyalgia rheumatica hurts in different joints, so throughout the body, and so different muscles groups. And so if you're hurting somewhere, use the light for a moment in that area. And for this gentleman that was having abdominal pain because of his stage 4 colon cancer, that was told in January, you're going to be dead in 4 weeks. And now we're May 26th and he's still alive. And so he was told comfort measures only. He's now taking nutrition and he's pain free. And
how many weeks would he be? How many weeks would it be now?
Well, let's see, 5 times 4, 20 weeks instead of the 4 weeks he was supposed to be dead, according to the oncologists at 2 major oncology places in Texas. And the names of it. Everybody's heard the names. So,
right.
But the bottom line is they said there's nothing they can do for him. And he was just suffering. They put fentanyl patches on him. He was just going down the tubes 4 months ago. And now he's pain free. He's sitting up, he's eating salmon, he's celebrating, he's talking to his family, he's making hopes and plans of going down to the Caribbean when he recovers. This is a different person that we're seeing. There's lots of things we're doing, but the thing that gives him immediate relief from his abdominal pain and stops it is this Super Palm 1050. And I hand it to him and say, hey, when the pain starts, use it. And he's using it when a pain starts, he uses the palm, the Super Palm for 4 seconds, he says now, and the pain's gone at a time.
That's crazy. Beautiful crazy. Let's put it that way.
Right.
So Jonathan is asking, can it be used with IBS, irritable bowel syndrome? If so, what protocol? And I would say that probably 5 minutes on each wavelength on an area probably is going to make a difference. You'll have to see. You might have to increase that, but that's a good shot. It wouldn't be the first time that we've seen somebody with IBS have a problem. Now, I do want to offer. I hope this is not medical advice. I'll just say what I went through. If
You're not giving medical advice, you're just doing this for educational and informational purposes.
Okay, all right. But in my own situation with IBS is that oh my gosh, in my situation, I would wake up at anywhere from 2 o'clock to 4 o'clock in the morning, bent over with severe pain. Oh my gosh, the pain was over the top, and that would happen every so often. And I was also put on different medication. They tried this, tried that. Nothing seemed to be helping me. And then I heard a person, a Christian doctor, who was saying on the I happened to be listening to this one. This goes way back when you had to actually, there was no podcast. You had to listen to it live. But I heard this guy say, hey, look at what you're eating and just write it down, all the stuff up to 24 hours ahead of time, and write it down and just see if there's something that you eat every time that could be causing that. And I went through my list, I started going through every time, writing down this, and peanuts. Next time it happened, this, and peanuts. And I thought, this, and peanuts. I thought, I wonder if there's a connection to peanuts. And in my situation, it was about anywhere from 4 to 6 hours after I had peanuts, I would be in pain, excruciating gut pain. And so I cut the peanuts out, no problems, gone, problem totally gone. Then about 2 months later, I used to like those Reese's peanut butter cups. Okay. I thought one little one couldn't hurt. Oh, that was a dumb move. Anyways, I learned pretty quickly that I can't tolerate peanuts, and it probably was my self-inflicted injury, because I used to clean up half the jar of Planters peanuts in one shot. So you might want to look, if you're having different issues, you might want to look at what you're eating, because and see if you can connect it back to a flare-up, as to when the flare-up occurs. Is that some idea that might be useful to somebody out there? I don't know.
I think there's a lot of facets, but as far as talking about near infrared and 1050 wavelength, the bottom line is, if there's inflammation, this might help. And this is a new technology, a new device, unique. And so I think we're going to learn as we go. But wow, the things that I've seen have been really impressive. Will it fix everything? I'm sure it won't.
Yeah.
But is it life-changing for the lady that had migraines for 12 years that was causing her to be bedridden for weeks at a time? Yeah. Is it a game changer for the guy that had back pain? He was totally pain-free. And the pain started to come back, but not at the same degree. And he got his Super Palm 1050 shipped to him. I think it came Saturday because he was panicking because he was about to go on a road trip from Texas to Arkansas to visit relatives, and he got it just in time so he'd have it for the
Excellent.
for bouncing down the highway.
And there's
And
no
so,
problems with this going on, putting it in your luggage, whether it be in your carry-on, because it doesn't have a battery. There's no problems with that that way. So I got Donna's asking any or any of your patients using the Palm Ultimate. So Dr. Bartlett doesn't have the Ultimate, but I can just say that we have seen some cases where people have bought both units, the Ultimate, they bought it because I had the Ultimate the longest. So they started using the Ultimate and they got to the point where they had really good shoulder pain relief. But it would just keep coming back with the Ultimate. And they decided their daughter needed a light. And so they bought the light for bought a new light for themselves, the Super. They went up a step and they gave their daughter the Ultimate. And the fellow said to me, my gosh, he says, this definitely takes it another step forward by using, because,
well, you
yeah.
triggered me. So I also had a lady who was scheduled for shoulder surgery for rotator cuff tears, and she came in for her pre-op physical. And I said, "Hey, I got this new device. I just met this inventor in San Diego, and it seems it helped this fellow with his back pain, stopped this migraine on another patient. You want to try it?" 10 minutes, her pain was almost gone in her shoulder. She canceled her surgery. And so is this going to happen for everybody? Probably
No,
not.
no.
But it did for her. And so, and I also there was another fellow, had a fellow with knee pain. It helped him in the pain behind his knee. And let's see, I'll think of the other one later, but I've had several crazy, impressive, effective results with patients all in a very short period of time. And so the treatment for all of these things have been 10 minutes or less with the red and then the near infrared. And I think the near infrared is really the game changer, that 1050.
Yep. I do believe that too. We're seeing additional things from that. Another question here from Marion. She said she bought a Super Palm and then she bought another one, um, a second one, and she was just wondering how to use the red and near infrared light. Now we get into that in some of our other videos that we have. We have a lot of videos on YouTube that you can watch about treatment. It basically it depends on the thickness of the tissue that you're going through. So if a person's treating their hand, they probably could get away with 1 minute of red, 1 minute of near infrared because it's a pretty thin body to penetrate. Usually when we're talking stuff around the above the neck, we're talking 1 minute and the red, and then 3 minutes of the near infrared on the area. And if you don't have the helmet and you're trying to treat your head, it's just a case of trying to treat yourself all the way around, unless you know specifically that, okay, for seizures, I have a trigger point right here and they can treat that point. I do know that has been very helpful to hit the target zone of where, if they know where it is. If it isn't, then you're just going to treat your whole skull. But that's 1 minute red, 3 minutes near infrared. And I do have people who have migraines that need to double that amount of time. So like 2 minutes of red and 6 minutes of the near infrared. Both wavelengths are very beneficial. The red helps with, even though it doesn't have the penetration that the 810 or the 1050 has, there's a lot of benefit because the blood can absorb those wavelengths and give energy to the cells that way. And it's also going much further than just the area you're treating. So it's yeah, so that's why we still use red even on the brain. You're going through the skull. We've been able to show that. As a matter of fact, I don't have my other skull here, so I'll have to use this guy here. We call him Alfred. We're very thankful to Alfred for demonstrating this. But the top of his head happens to be at another show. So we have to do it this way. But here's the back of the skull. And I'm just going to do the light. And you can see that the light is going right through the skull. No problem with the red. So we're causing, one of the things that happens with red light is that you're causing vasodilation. So you're causing more blood flow through nitric oxide that is created through the use of the light. So yes, the light can go through the skull, no problem, even the red at 810 or in 1050, but the 810, 1050 is far deeper penetration.
You're going where you've been where I have not been. I've told my experiences, but is there a risk of using it for too long a time?
Oh, excellent question. Thank you. So we haven't had any real side effects that are ones that we can attribute to too long of treatment. But one thing I do know is that when we're talking the brain, we want to ramp our light up in treatment time. You don't want to go for the full out, especially on some of these cognitive issues. So it's like a pendulum. You pull the pendulum all the way one way, and if you release it all in one shot, my gosh, you get a swinging effect in stuff going on in the brain. I did learn that early on with autism, that the kid was like, it was just tremendous. I mean, going from one, very white to very down, like regulated, but it was just too much too quickly. It needed to be, slowed as the treatment slowed in, brought in slowly. So other than that, I've had people treating musculoskeletal issues, so anything below the neck down. And like one guy in particular, he had a very bad sprain, and this was like still 3 months after, and his foot was extremely swollen. And he went through we had the mini canopy, this guy here, and because we were in a meeting, he just put his side of his foot along here, and we went into it about 20 minutes. And I said, now let's see how you're doing. And he's walking across the floor, and he says, it's a lot better. It's not as painful as it was. And I says, well, we got still the meeting. Let's just keep doing this. There's nothing that I've seen. And he went and treated, like we went on for the meeting, went for another hour. And after the hour, he was walking around. He says, this is unbelievable. The pain is totally gone. So we didn't have a problem with that. One thing that I need to clarify is that there is some research that says, they say a certain amount of energy, that's all you want. And it's like this, it's a graph with the going up, and then it shows going down to the thing. Now that, so I, even with one of my employees, I had discussed, he showed me, he says, look, it's 4 joules is right on the top there. That's your best treatment. Beyond that, it's, you're losing ground. And I said, yeah, but the problem with that is that whole study was based on a rat's knee. So a rat's knee is a pretty small diameter. So you can imagine 4 joules, you can hit that in a minute with my light. So, but we have a normal knee that's kind of like this or bigger. And so you have a lot of light that's lost, a lot of energy that's lost by the time you get even in the first centimeter into the body. So,
Tom, I see a question about macular degeneration.
yes.
And I actually had an optometrist, retired optometrist, ask me. He suggested that he thought it might be effective for that. I don't know, but that's a good question.
That's a very good question. Thank you for catching that. So as far as macular degeneration, we've been able to help with wet and dry macular degeneration. There is actually a study out there for dry macular degeneration. A company got out there. They had a box that you looked into that you do at the optometrist office, and it was a pretty expensive treatment, pretty expensive box. In the end, it helps with dry macular degeneration. We have a number of individuals with dry macular degeneration that have improved with this light. So they do. I recommend they close their eyelids. That's a must, okay? Because what the eyelids do is diffuse the light in all directions, and then do 1 minute of the red and 1 minute of the near infrared with the eyelids closed on both eyes. So a total of 4 minutes. The oldest person to do that is 101 years old, and she had dry macular degeneration. And she said, I have the video of her about a month ago, maybe 2 months ago now. She described the lines in my shop, and she said those lines used to be very wavy, and then she says now they're nice and straight again. And so she used that protocol for was around a month. We also had somebody else who was a senior that had it dry macular degeneration. She says it's almost like somebody washed all the windows in the house. Everything was clear, from just a few treatments. So it's possible to help with dry macular degeneration. But with wet macular degeneration, we've actually seen the floaters disappear. And those are on people, like one of the individuals, she is in her mid-70s, and she was getting the shots in her eyes for the wet macular degeneration for years. And she didn't like it. It's so painful. She didn't want to do it anymore. And it was at that time that her daughter and son-in-law, who went to the same church as I did, asked me about could the light be helpful for her mom's eyes. And I said that everything, this goes back a ways now, at least 2 years now. But I said, I think it could be helpful from everything we've learned. And within a month, she was already able to see improvements, and I was able to keep improving her vision on one of the eyes with using the light. The other eye didn't improve. But the main thing was the floaters that were really driving her nuts, and they disappeared. So we've had a number of senior ladies that have used that. And that woman, she used it for, she's been using it now for, I guess now it's getting on to 2 years, and her eyesight's still doing well. And she had the wet macular degeneration. She hasn't been getting those shots.
There's also a question about if any imaging was done on the shoulder tear that was going to have surgery. So the cardinal signs of inflammation are redness, pain, swelling. That's a basic first-year medical school exam question. And so you can still have an injury, but you can have less pain. And so I'm not thinking that this fixed anything immediately, but it did decrease the pain, just like the migraine stopped, the back pain stopped. That's inflammation resolving, and the pain is gone. So that's different than a torn tendon mending together immediately. I'm not.
Yeah, I wouldn't say it's not immediate, but even, well, Dr. Ryan Cole. I got to know Dr. Ryan Cole when he came to Toronto at one time, and I met up with him, and he had so afterwards we went to kind of like a get together at a person's home, and so I was talking to him about using the light for myocarditis, the swelling in the heart, inflammation, and he thought that would be a very possible applicable use of the light. But as I'm talking to him further, he says, I says, so do you have any pain? And he says, oh yeah, my shoulder. He says, yeah, like it's so painful. He threw a bale of hay, and then he says it immediately. So he tore some tendons in there, and they said it was going to be 4 months. Well, he did put the light on his shoulder like that at this home, and then in about 20 minutes, he says, oh my gosh, look at how much more range of motion I can get. And he says, that's got to be 60% less painful. And that was just in that time. So I got him one of the lights immediately so he could take it back with him. And he's on one of my webinars as well, but they told him it was going to be 4 months before he'd be have that healed up, whatever tears were there. And 1 month, he says my shoulder was totally back to normal. So really, really speeds up healing. We have a lot of great slides on healing on the body.
So I see Susan said that the Super Palm is effective in resolving atrial fibrillation after 3 treatments. I don't know. I haven't used it for that, but that would be amazing. That'd be wonderful if it helps with that.
Yeah, Susan's a nurse, and so she understands this better than far better than I understand.
That'd be wonderful. I'm all for anything that works. And there's another comment here about a dog with bladder cancer that was told it was going to die soon, and after 4 weeks of getting the Super Palm treatment, the dog is doing well. I don't know. I'm not a vet, but it makes sense. It decreases inflammation. We know that much.
Yeah. So I see Donna's here. I'm bouncing around a little bit. I used the Palm Ultimate on a torn ligament in my ankle, and in 2 days I was standing and walking at a 2-day outdoor dog show that I had to participate in.
Someone asked about plantar fasciitis. It seems like this would be really.
It is. So one of the guys up here is a runner, and he wanted to do a half marathon. And he did that routinely before, like every year. And he had plantar fasciitis, and he was able to use the light on his bottom of his foot where the issue was, and was able to go back into did the half marathon, and did very good timing on it. So, I mean, this should be in every sports facility, and I can't release it yet, but we have our release the name yet, but we have our first national football team that's just purchased one of the helmets. So wait till they find out that their competitors have the helmet, because there is a study that shows how much better they did, like 2 years of light treatment for the one team. And then they took 2 years off as a sabbatical, and then 2 years back on, and their scores were much higher during the time where they were treating. And part of that is the cognitive improvement was there. They can see their brain is able to process faster. And so that's a study that's out there by another light device. It's called the V-Light, with some little smaller optical modules that they use in certain places. That's kind of like almost like a headphone, and they found that. By the way, there's a question about what about the links for these devices for research. If you go to my PayPal. I got another computer open here. If you go to my website, you can see under the research tab, you can see a block that talks about research articles, and there's a database there of over 8,000 research articles on using light. So there's a lot out there now. Unfortunately, some of the research articles just don't have the optical power. They might show it works well on a slide, but it's not there. It's got to be enough power to get in through the tissue. So there is some really good data. There's a good database there. And I see Faith has put it out there for us, the link for that. Now, I wonder if Kylie was able to come in. Do you want to have a look here? Nope, I guess she couldn't make it tonight. Oh well. But it would have been fascinating to hear her come on. Okay, so I mean, it's your choice. There's a question about with the what AMD. It's your decision whether you want to use it with meds or not use it with meds. But I'm just saying this woman was had her fill of getting the shots, so she decided not to get the shots anymore, and that's when she started using the light and benefiting from that.
You
Okay.
know, Tom, informed consent is a basic patient right. In the American Medical Association Code of Medical Ethics, it says that every patient deserves and has a right to know informed consent. And it's a doctor's responsibility. And informed consent is telling every treatment option and the risk and benefit of every treatment option. And if there's a financial conflict of interest, this clearly has helped someone with a very debilitating chronic migraine problem get free. It helped someone else with a chronic back pain improve. So this is a treatment option that I cannot not tell a patient about now. And just because it's not a prescription, just because it's something they can do with on their own without being in my office, I'm actually happy about that. But I think this really ethically should be discussed by every doctor that hears about it. And if they don't hear about it, they need to do the research and learn about it because it's out now.
Yeah, it is. It is. And so, wow, I am getting some thank yous here and some other thank you, Dr. Bartlett, for coming on tonight. This is really, really good information. So we got a lot of folks on tonight. It's been a great webinar. Dr. Bartlett, I'm so thankful that you're able to come on tonight. I know that we will be posting this video within a week on our YouTube channel. So anybody who wants to go back and watch it or spread it to other people, this would be a great way of getting it out there. And just want to remind people to click the subscribe button so that they can be aware of when the next video comes out that we put together. And also remember to like, because if you click that like button, it puts the algorithm out there and a lot more people hear about this. So not only will they hear about it, but then they'll tell others. So I want to thank you.
One more thought, for patients who are really suffering constantly with chronic pain, they get appointments with pain management doctors, and they wait very long periods of time because there's so many people suffering with that. Wouldn't that be something if the wait to get in with the pain doctor decreases because less people are having to see the pain doctor because more of the super palm 1050s out there in the community? I think it's quite possible that you might be putting a dent in some of the specialties practices.
Well, if they can see their patients much quicker that they need to see, then that's a good thing, right?
It is a good
So,
thing.
yeah, we'll keep trying to do the right thing. Boy, do I ever thank you for coming on. And any last thoughts? That was a great one, by the way. Okay.
Well, migraines, that's a very common problem. And neurology, people bounce from neurologist to neurologist. You talk about Botox injections for the musculoskeletal tension component. You're using medicines that affect the blood vessels to your brain and interfere with the constriction and dilation of blood vessels. How about this instead? This sounds a little less risky potentially. So I think, we know ultraviolet causes cancer, ultraviolet C.
Yeah.
But this is infrared at the other end of the spectrum.
Exactly.
And so this is at the full other end through the visible light spectrum to the other side.
Which is extremely safe, that whole other side. Yeah.
Apparently so. And so I don't know that there is a limit or what the safety limits are on this. I do not know. But I do know I've seen some crazy good results. I think of all the sprains, all the strains that happen in sports, but also in life and in ERs. And this, a lot of things are just a pain issue. When they come to the emergency room, the thing that's the biggest issue is the pain itself. And that's
Right.
what I'm seeing this resolve for many people.
Well, we had at the one event in Virginia, it was at a big high school, and the high school is off, so they used the gymnasium and everything for this health freedom event. And one of the students happened to be coming through, and he had his crutches, and you could see his foot was like really huge and black and blue, and he's hobbling along, and I says, okay. I says, you got to try this. He says, what do you mean? I says, no, just come on, sit down for 15 minutes. And he was kind of like, oh, what are we going to do here? And so he did.
Did you put the helmet over his head?
Yeah, he he did the light treatment. And the next day, he even right after that, he says, I can even put a little pressure on this foot now. I couldn't do that before. Like it would just send me through the roof. And then the next day he was in, and he said, look, and he actually is walking on his foot, but very carefully. And then he does another treatment, and he says, look at this. And he picks up his other foot, has all the weight, doesn't use the crutches at all, and has all the weight on the foot that had the sprain. That was 2 treatments, 2 days of time. So yeah, the whole area of sports could be helped with enough power like this. So
Tom, one of the things that used to be done by professional trainers and football players would be injecting corticosteroids in joints, trying to decrease the inflammation and the pain, which will weaken the tissues there, and actually has a lot of negative effects. Besides sticking a needle in something, you have a risk of infection. This is just light years ahead of that as far as being safer and more effective.
Yeah. Well, and there's a email or text here from Grace, a retired physician. Grace, please do connect with us. And there is a lot of information on our YouTube channel too, to learn more about how to use this. So, wow, once again, thank you so much, Dr. Bartlett, for being on tonight. I thank everyone for joining us, and I wish for you God's richest blessings through this coming week. Thank you. Thank you again.